welcome, welcome, welcome to Health Issues. I'm your host, Sylvain, and we are truly honored and excited today. We have truly a distinguished guest and an honored guest. We actually have Dr. Cecilia Mouton. She is the Executive Director of the Louisiana State Board of Medical Examiners. Welcome, Dr. Mouton.
Thank you so much. I'm happy to be here today.
Well, we're excited to have you. We're such an honor, and it's really an organization that most people may have never heard about. You know, who is the State Board of Medical? Would it tell us a little bit about what you guys do?
I'm happy to. The Board of Medical Examiners is actually one of the oldest boards in the country, and what we do is we license physicians and 11 other categories: PAs, midwives, respiratory therapists, occupational therapists, medical psychologists, athletic trainers, polysomnographers. I don't want to leave anybody out, but the biggest group are the physicians.
Okay.
We license them and we regulate them.
Okay.
We discipline them when necessary.
Okay.
And the mission of the board is to protect the public through licensing and regulating these group of healthcare providers. So what we do is we also promulgate rules and opinions that are used by our licensees in telling them how they need to practice. From the public perspective, we respond to written complaints.
Okay.
And so as a state agency, a lot of times the public might, if they had a bad experience with a doctor, they'll write to the Medicaid hotline or one of those kind of things.
Right,
and we are similar. We take written complaints from the public, and then we would investigate that complaint.
Okay. All right. And you're a physician yourself?
I am. Yeah.
Okay. And tell us a little bit about your practice at Charity.
I went to LSU.
Oh, wow.
I did my residency at Charity in internal medicine, and then I spent an extra year being the clinic chief. So I ran the clinic, the medicine clinic at Charity for a year.
Okay.
And then I stayed on the faculty at LSU, and then I took a position at Touro. For about 10 years. Touro had it was called the Touro Foundation. It was a free clinic for patients in that neighborhood. And then one of my mentors called me and asked me if I wanted to come help him at the board. And even being a physician, I didn't know what the board did. So I moved over probably part-time in 1996.
Wow.
In 2005, Dr. Beaubert retired, and then I assumed his position.
Wow.
I became the director of investigation, and then in July I became the executive director.
Awesome. Awesome.
So I've been doing it for a long time.
A long time.
Yes.
A long time. A long time. So, but the concept of the relationship with physicians, but having been a physician, that's a lot of respect.
Yeah, I think what is unique about the Louisiana Medical Board that doesn't occur in other boards, every other state has a board of, some sort of board of medical examiners. I think having a physician in this position, I think it gives, you know, that added understanding of what are the challenges that physicians are facing.
Right.
And I think it allows for a more balanced approach in how we respond to the complaints from the public. Right. And so I do think having a physician in this role is important and allows us, I think, to be successful in what we're trying to do.
I think that's awesome. I guess from the public standpoint, though, the physician, if there's anybody on about 6 steps away from God, I mean, you know, the physician, you know, people in society, in American society, and I don't know about any other country, but in American society, the physician, obviously, I guess, the most trusted, respected many times, and that people truly don't understand what they're saying half the time, but you know, that they honor them.
Yeah, it is. Physicians do have more power because of their education and their authority in a relationship with a patient. And patients, you have to trust that person who's your doctor.
Right.
And so that's why, you know, we investigate allegations of unprofessional conduct where a physician has been deceitful or hasn't been telling the truth, or because it undermines the public's trust in their physician.
Right.
You know, when I am teaching, which I used to work at LSU teaching ethics to freshman medical students, and I used to tell them, you know, because they start as just people when they start medical school, yet by the time they finish their training 8 years later, I said, a patient walks into your office and you tell them to take off their clothes, and you can put things in their, you know, you can lay hands on them, and it's okay, and because you're a doctor, and with that privilege comes responsibility. And so yes, I think physicians do have to behave differently. They do have to appear to well, I'll just say they just have to appear to behave better.
The white jacket.
Yeah, it bestows. I mean, I think ministers, physicians, you know, the public respects and elevates us, and there is responsibility in how we should behave. Yeah. You know, to earn the trust of the patients.
But from a, I still think, and I don't know, I mean, I haven't seen the poll, but that people, from my own experiences, when the idea of a physician not operating at that level, it's almost like an oxymoron. When you say physician, it's almost as if they've gone through school. There's no way they can go low, but not so low.
I hope that's the case. I think in the vast majority, 99% of physicians probably operate that way. Unfortunately, there is a small percentage of physicians that do violate the public trust, and they end up being disciplined, and that's my job. Yeah.
And that's your, and I guess that's where we're headed, because people need to be able to trust their physicians.
Yes, yeah.
Because if they don't, then they start self-treating, and
absolutely,
and then we're in trouble.
And you have to believe that the doctor who's writing you a prescription or he's recommending a surgery, you have to believe that your interests are the most important thing, not how much money he's going to make this year. Right. Or it has for there to be that trust, the patient has to believe that the patient comes first. And I believe that the length of training of physicians and the people that choose to go to medical school overall, the vast majority are that kind of person, you know, who desires a life of service in a sense, because your patients come before your own needs or the needs of your family sometimes, you know. I think in this modern age that we live in, there is some change of how the old-fashioned, you know, Marcus Welby, MD, and where we are with, you know, the new group of doctors. I think doctors are more, are trying more to maintain their own personal lives.
They wear tennis shoes.
Yeah. You know, they don't, you know, call, you know, they don't want to miss their children's school events. I mean, so doctors are trying to balance, again, having a more normal life, you know, so.
You're right. I mean, culture is changed. An idea, and a doctor with jeans on. No, you don't have jeans. You're a doctor. You know,
right.
What do you mean?
I think overall everything is a little bit more casual than it used to be, and that may be a good thing.
But they're saying, hey, Mrs. Jones, your mother's going to die. That's the person who says, your mother, you know, Jerry, you have cancer.
Right.
This is the person where the whole family comes in to listen to. They come, they speak. They have 12 people in the room, and they come in, they speak, they walk, and they have that authority.
Right. I think that just comes from the 8 years of training. Like I say, you take, you know, a 21-year-old kid that walks in, starts medical school, and at the end of it, they've learned how to carry themselves as physicians. They've learned to accept that that is the role of a physician. And hopefully they have that authority to be able to go into a room and offer comfort, you know, to a patient in that sort of situation and their family.
But again, you know, and we'll flip it around, because we definitely needed to lay that base of who we're dealing with and what it is, and the honor and respect that's due. But then the complexity of the big issue. I mean, obviously you have incompetence, malpractice, and those types of things, and you know, those types of things. But would you say the major issue is dealing with opiates?
I think one of the challenges facing medicine today is the expansion of prescription opiate prescriptions and increasing amounts of overdose deaths. I think that the data is that since 1999, the numbers of overdose deaths due to prescription opioids, which is methadone, oxycodone, or Percocet, and hydrocodone, which is Vicodin or Lorcet, that the numbers of overdose deaths alone exceed the deaths from heroin and cocaine combined. And in 2008, we're very close to the number of deaths from motor vehicle accidents, which is the #1 cause of death in the United States. So prescription drug abuse is it is an epidemic, it's a catastrophe, and it is physicians, people are getting the drugs because physicians are writing the drugs. So it is a physician problem. And so it is something that the Board of Medical Examiners is very concerned about, as are several other agencies, the DEA, and there are lots of players in trying to understand how do we get to this problem, how do we regulate this problem, and how do we make sure that the patients who legitimately need these drugs do get the drugs, because most of these drugs are prescribed for legitimate reasons to legitimate patients. But unfortunately, there is an increasing number of patients who are getting opiates who are developing addiction or are selling them or whatever, and then it's contributing to death, patient death. And the age group that's most affected are men 36 to 54.
Why is that?
I don't know the answer to that question.
Yeah.
I don't know.
Wow,
Yeah.
that's amazing. But a young kid, like you say, 21 years old, and I laugh at it all the time because I spend time at the university sometimes, and I always see the young kids trying to look hip. And I'm saying, you got a 4.0, you're not hip. Right? You're in college, don't act like the guys, who had a crack mother or whatever. It's a different thing, but these kids, they had awesome grade point averages, strong student, and then they're exposed to people coming in with a lot of tricks and challenges, organized crime, as you say, the addictions, and is there anything to get these kids ready for what they're about to walk into?
You mean the young doctors?
The young doctors, they walk in, and at what point in their career, and you put these people that, hard street life many times, the ones that's creating a diversion.
Well, I was reading an article from the CDC, which sent out an alert, and they're increasingly sending out alerts to help notify physicians about what a problem this is. And I think what's important to keep in mind is that the people that we're talking about are not legitimate patients who need pain medications and go to their doctor and get their drugs, whatever it may be. But these are people who are abusing the drugs. And what is abuse? They are taking the drugs for non-medical purposes to get high. They're taking the drugs for euphoria. And 80% of those people who are abusing drugs are not getting the drugs from it being prescribed to them. Only 20% of those people who are abusing drugs are getting it from a prescription from their doctor. The majority is diversion. So they're getting it from their friends or families, or they're buying it from a drug dealer. And the most recent data that I looked at said that there were 10 million Americans in 2010, 10 million Americans who are abusing opioid prescription drugs. It's a huge problem. But again, it isn't it isn't that these are patients who are going to their doctor. I want to keep stressing that.
Right.
But it does relate to physicians who are prescribing to somebody who's turning around and selling it, or, you know, diverting it. They're diverting it. And so part of the approach that the board has is really to educate physicians. The patient-physician relationship is based upon trust. And the physician, when a patient comes in and says, I'm in pain, and we want to help you. And if you say, I'm in a lot of pain, I need hydrocodone for my pain, the doctor, more likely than not, is going to believe you and trust you. And so he may write you a prescription, and then you may come in next month and say, I need more, I need more, I need more. And you may not really be a legitimate patient. You may be seeing several doctors telling them the same story. And you may be turning around selling them to young people who are mixing alcohol with hydrocodone. And those are the people that tend to overdose, the people that abuse lots of different substances. So part of our focus is to educate physicians to be aware of these sorts of diversion schemes, to be suspicious of people that come in. And doctors aren't comfortable. You know, sometimes when I meet with a doctor, they say, well, I'm not a policeman. What am I supposed to do? You know, polygraph my patient? He told me this. I believed him. And so really it's, and again, I'm going to call them professional drug dealers, these people who go to doctors' offices for the sole purpose of getting opiates to sell or to take because they have a problem. Physicians need to know how to recognize that patient. The other thing physicians need more education in is recognizing when one of their patients may become addicted. Like, what are the warning signs that a physician should be aware of that, wow, my patient may be suffering from addiction now, and I need to be very careful. Maybe I shouldn't be giving him more drugs. Maybe I need to consult someone, an addiction specialist to help me with this patient. There are other tools that we recommend physicians use, and we try to educate to use the PMP. The PMP is a database that physicians can access, that we tell them they should access if they're writing controlled substances, because it will identify those patients that are receiving narcotics from more than one doctor. Some patients may not know. They may be getting Vicodin from one doctor and Lortab from another, and they didn't know they're the same thing. They could be getting cough syrup that has hydrocodone in it. And so the PMP is a valuable tool, not only to detect doctor shoppers or the illegitimate patient, but also to make sure that you're not going to over-medicate your patient, and that the patient really did know that they shouldn't be taking these combination of drugs. So the PMP is something we're trying to educate physicians on. We work with the DEA to educate physicians on no diversion schemes. The third thing that we do at the board is we've developed pain rules. The pain rules establish, if you're going to give chronic narcotic therapy to a pain patient, they establish the standard of care. What needs to be in your record? What do you need to document? And so they give physicians guidance on what is appropriate in treating these patients.
Well, let's look at it from a patient standpoint. Some patients will become addicted.
Yes.
All right, they broke their hip or whatever, and they're on oxycodone. There's only drugs available for the most part to deal with chronic pain, you know. And so the patient becomes addicted. Is there anything to help that patient? Because then this doctor cuts them off, then they go to another doctor.
Right.
the patient started off legitimately,
Right.
but they got into a system that
Right.
hurt them.
Right.
And now they start off as a patient, they become a victim.
Right.
Then the patient becomes a criminal,
Right.
all attempting to just get help.
Right. That comes into whether or not we have adequate treatment in this state for substance use disorders. And unfortunately, I don't believe that we do. So there are a subset of patients that inadvertently, if 10% of people who take chronic opiates would become addicted. And that's what I've been told. And so what will happen in your scenario, the doctor, you had surgery and it's 6 months later and the doctor's uncomfortable because the patient is needing more and more opiates. He's uncomfortable, and so he just says, I can't treat you anymore, and he cuts you off. And so now you're on the street, and you might even start doctor shopping because you're addicted and you're trying to, you know, prevent yourself from going into withdrawal. Drug treatment. And what we would, you know, sometimes when we talk to physicians, we're trying to educate them, we'll say, when you have that scenario where you recognize it's a problem, refer them to one of our substance use centers. Well, there are none.
Right.
They don't have money to pay for that. And so the lack of resources to refer these patients to, who for no fault of their own became addicted, it is a terrible problem. It's a terrible problem. But the options are, if you could get into drug treatment centers, there is Suboxone therapy, which is available for people who have opiate addiction to help wean them off of the opiates. But far too often, this story doesn't end well. You know?
Yeah, and if there was a drug that could have stopped the pain without creating the addiction,
Yes.
the patient wouldn't have been, because the patient doesn't know the options of drugs available, and
Right.
it becomes a real challenge. Part two becomes, because of the patient then in that doctor shopping, pharmacy shopping, everywhere else like that, the patient who looks, and that's what the doctor says, you know, hey, I can't polygraph them. The patient who looks like they can't be trusted.
Right.
It looked like the guy on the billboard.
Right.
You know what I mean? And
Yeah.
so, would it be that they wouldn't get pain medication, but the little old lady would get pain medication?
I think you're probably right, and the message that, you know, when I'm working with the physician to try to rehabilitate his practice, you know, a lot of times they'll come in and go, but I trust Miss Jones. I mean, Miss Jones has been my patient for 10 years. She would never, I know her. And I said, Miss Jones is doctor shopping. Miss Jones has been arrested for selling drugs. I mean, and so you can't judge the patient by what he looks like, because, and my message to doctors is, if you're going to be using chronic opiates, you have to be vigilant. You have to use the tools available, the PMP. You know, you need to learn about diversion, learn to recognize all of these things, but you can't judge a book by its cover, you know. The guy that looks like a thug is probably legitimately taking the medication, and the little old lady is the drug dealer in the neighborhood. I'm just kidding.
Yeah,
you know
literally, but literally, literally, I've seen it. I've seen it. You know, I've seen it. But now, for a patient though, from coming in, how do they know? Because everybody prescribes #1 prescribed drug in the world.
Yeah.
So chronic pain, people, you know, every 30 days or whatever. That's, you know, from the best physicians to gold standard physicians, down to the seedy guy. So again, we have this physician that is very high on a pedestal. How does a patient differentiate between the gold standard physician that's doing all of the holistic, multi-specialty clinic and the whole bit, from the guy, you know, who's just checking your tongue? How does a patient know that this is illegitimate, that something's wrong with that? That, say, particularly not even a third grade graduate, you know, how do they know?
You know, that's a very good question. I think patients probably can look to see, well, this guy didn't spend any time with me, he didn't examine me, he just took my money and wrote me a script, I was in there for 5 minutes. I mean, those are the obvious that a patient would say, I'm not going back, that guy didn't do anything for me but give me a prescription. But the other thing is, I think, you know, through a program like this, I think patients need to become educated as well about these drugs are not benign and that they need to respect them. And the doctor may, through his lack of education, give somebody 50 Percocet and say, just take them every 4 hours as needed. But there might be a patient who is prone to getting addicted. And if he took it that way, he could get addicted. But the patients need to understand that these are dangerous drugs. They're controlled by the DEA. There is an addiction potential, and that they should probably try to be careful in how they're taking them. Don't give them to their friends. Don't give them to, you know, and I think that's what happens too, is people will have the drug, they'll give it to family members, and that could cause problems as well.
You know, the web is amazing. The web has, and we have a couple of minutes left, the web has these different sites, health grades that kind of measure doctors or whatever. But as far as for the board, any you know, legal function, until a doctor is all the way going to jail, nobody knows. So it's a whole long period where the pharmacist doesn't know, the doctor doesn't know. I mean, the patients, other doctors don't know, and so it's a secret as far as for what's happening in those offices. Only the patient and the doctor knows.
I think, you know, if you want to check out your physician, you can go on our website and see if he has been the subject of discipline. And then if you're concerned, we encourage people to go to our website and contact us and make a complaint. And again, keep in mind that we try to educate and remediate. You're not going to know about that. We do that privately. But if a doctor has really crossed the line repeatedly, then you're going to find him on our website. Yeah,
because there's so much, you know, again, it's secrecy, which is supposed to be secret, but if, you know, is the doctor doing MRIs or is he not? How does anybody know? You know what I mean? Particularly if they're not that patient. People shopping for doctors, I mean, for legitimately.
Yeah, I mean, I think if you're going to trust your instincts, look up the doctor on our website, make sure he's licensed, see if he has discipline, trust your instincts. If you think he's a good guy, chances are you're in good hands.
Thank you, Dr. Mouton. This is awesome. Work as hard as you can, learn as much as you can, ask great questions. We appreciate you. Thank you so much. Health Issues.